I'm Nisha Wilson. I'm the Oncology Infusion Director. I wanted to share that the Foundation has supported my endeavor to further my education through scholarships. With obtaining my master's degree in business with emphasis in healthcare, it will enhance my current position as the director.
Hello, Delta Health Foundation. I'm Dr. Cole. I'm one of the general surgeons here in Delta, and I wanted to say thanks to you all for helping us to get the Scout localization device for treating patients with breast tumors. Before we had the Scout, we were using wires to localize these small tumors that you can't feel in patients' breasts, which was great, but at times required a lot of additional dissection, bigger incisions to follow these courses that the wire would go, which wasn't always directly at the tumor. Now with the Scout device, you can put the incision right over the area where the tumor is, and you know exactly where the tumor is without having to guess which direction you think that wire is going. And for me, it's really been a game changer in breast surgery. Smaller incisions, less trauma to the patient's breast means less pain for the patients afterwards, and it means lower likelihoods of having complications like fluid collections, infections, and I really am grateful to have it here at Delta. I think it's a great thing for the patients in our community, and again, I want to thank you guys at the Foundation for helping support us in this endeavor.
Hi, my name is Arian. I am one of the oncology nurse navigators at the Oncology and Hematology office here at Delta Health. One of the things that we provide to our patients is we spend about an hour to an hour and a half of teaching what patients can anticipate, not only their treatment plan to be, but those side effects that they potentially will have to walk through. One of the things that we are able to offer because of our generous community and foundation support is we are able to provide each patient with a port t-shirt. It can either be long sleeve, short sleeve. The basis behind them is that they have zippers on either side, and those make it easy for the nurse to be able to access patients' ports. The importance of that is basically that port is their lifeline. We're able to draw blood through that, draw their labs back, and be able to infuse their chemotherapy through those ports. Because of that community support and the Delta Health Foundation, we are able to offer these port shirts as just another way to provide comfort to our patients and ease of access to their port. And we're really thankful for being able to offer that to them for this next phase in their oncology journey.
I'm Barb Lamoni. I'm from Paoni, Colorado, and I've been receiving treatment here in Delta since April 20th of 2020. So that's when I was initially diagnosed with breast cancer, and after the biopsy found out it was HER2 positive, which I think is probably one of the worst ones, but you know, it's difficult because you know you're doing good and you're feeling fine and things happen, so you know you come in for the ultrasound, and after the diagnosis it went from stage 1, 2 to 4 like overnight. So it's a really fast moving cancer. But because of the treatment that I've received here, I would say that I am, even though they say you're in remission, technically it's not really remission with incurable cancer. So I am surviving it, and it's been 4 years now. I'm heading into my 5th year. I don't think that I would have received better treatment anywhere else. I had a girlfriend when this first went down that insisted I had to have a second opinion. Let's go to Cancer Treatment Centers of America. And I was so happy that I had a really good facility to come back home to. And I feel that I have received better care here than I would have anywhere else. You know, obviously I've been receiving treatment every 3 weeks since this started. And so I know everyone in the infusion center, and I'd say it doesn't matter which nurse you get, they're all great. They all treat you with respect. They're willing to sit with you and cry with you if that's one of the days that you're having. But, you know, usually when I come in, everyone's in a good mood. They're willing to help you. They match your mood. And I try to keep it up for them because I know they're dealing with a lot of other patients with cancer that probably have worse battles than I do going on. I think that's one of the key things for me, is that it's really nice that I have been able to have my treatments right where I live, because I'm here every 3 weeks. So like I said, I know all the gals down there. They do a great job, and it's nice because I don't have to travel hours, and I don't have to stay in a facility out of state or somewhere else in the state to receive the kind of treatment that I'm getting. It's right here in my backyard.
My name's Kyle Nickel. I'm a general surgeon here in Delta. I've been here for about 10 years now. Scout is a newer technology that helps us with breast conservation therapy. So people have heard of lumpectomies, which is more accurately called breast conservation therapy. So if a woman has a breast cancer, instead of having to do a mastectomy with or without reconstruction, we can just remove the tumor and some normal tissue around it. Historically, how that worked was with what's called wire localization. So the radiologist would place a thin wire the morning of surgery into the breast, leading us to the breast lesion that we're after. The problem with that was that oftentimes, for technical reasons, the radiologist had to take a maybe less than optimal route from the skin to the breast tumor. What Scout does is allow the radiologist to place a marker, or called a reflector, the Scout reflector, which we can remotely detect with a handheld wand. So some of the advantages of that are it can be placed anytime before the procedure, so it doesn't need to be just on the morning of surgery. And we can then choose our surgical approach to that lesion based more on cosmetic or other considerations, rather than having our hands somewhat tied by the wire that was placed by the radiologist. The reason I was passionate about getting this technology here is because just being in a small town doesn't mean we should do small-time things. We should be keeping up technology-wise with everybody else in the country. Sometimes that's not possible, but fortunately in this instance, the foundation board was able to finance this purchase, and puts us up there with what the universities are using.
My name is Teresa Rick, and I am an oncology nurse navigator at Delta Health Oncology and Hematology. I have the privilege of sitting with patients doing their chemotherapy education and providing gift cards, they're both gas and grocery gift cards, to the patients when they start treatment. The gift cards come to our patients through the form of community support. Organizations like the North Fork Miners volleyball and football team, and the Starvin' Arvin's staff members here at the Delta Restaurant, and many other community organizations provide these funds to our patients. They are housed here at Delta Health through our foundation, and they're given out in the form of $50 gas and grocery cards to our patients that are starting on treatment. When patients receive these cards, they're so touched by the community support. And what's equally touching to me as a staff member who gives these out is the patients to decline them and ask that they be given to patients in greater need than themselves.